We've all had it happen. A child becomes ill during the time he or she is at our child care facility, and it can happen quickly. The parent may have just dropped the child off for care as he or she heads to work, to run a few errands, or to enjoy a day to themselves before they return to pick up their sweet angel. Sometimes the parent already knew the child might be coming down with something, or the child may unexpectedly become ill. Children in child care facilities are 2 to 3 times more likely to acquire infections and illnesses that affect their health than children who are kept at home. Because of that, child care providers must constantly monitor the children in their care to keep illnesses from spreading to the other children and workers in their facility. When a child care provider notices that a child is obviously not feeling well, the child needs to be assessed, and regulations should be checked to determine if the child can remain at the facility. A child should not be admitted for care if one or the more of the following applies to that child. The child is not comfortably able to participate in scheduled activities. There is a need for more care than usual for this child, which compromises the health, safety, and supervision of the other children. The child has an elevated temperature of 101 degrees Fahrenheit orally in the mouth, 102 degrees Fahrenheit rectally in the bottom, or 100 degrees Fahrenheit axillary under the arm. Other signs of illness or behavioral changes are present, such as lethargy, abnormal breathing, such as heavy breathing, wheezing, or shallow breathing, uncontrolled diarrhea, 2 or more vomiting episodes in a 24-hour period, or a rash with fever. If none of these symptoms apply, accept the child into care and proceed with the routine and schedule of the day. Only designated Get Well centers have the facilities and regulations to care for ill children, unless the child exhibits the symptoms of excusable illness or injury. If a child appears to not feel well, but the child is quite young and has a limited vocabulary, have the child point to a sick doll to explain where he or she hurts or feels bad. Seasonal flu, which is caused by a virus, is one of the designated excusable illnesses according to the Texas Department of State Health Services. It affects the upper respiratory system. Symptoms of the flu include a sudden high fever, 100.4 degrees Fahrenheit or higher, dry cough, sore throat, muscle aches and pains, runny or stuffy nose, headache, and a lack of energy. Some may have diarrhea, nausea, and vomiting, which is more common in children. Some complications of seasonal flu include ear infections, sinus infections, pneumonia, dehydration, and even death. Young children under the age of 2, pregnant women, the elderly, and those with compromised immune systems or who have already a chronic illness such as asthma or diabetes are especially vulnerable. The flu is highly contagious and something you do not want spreading through your child care facility. The majority of flu cases are mild, and most people feel better after treating the flu symptoms at home for several days. However, it can be dangerous. In severe cases, those infected with the flu virus will be hospitalized, and some may even die from complications. If the child starts to become ill with a flu-like illness while in your care, immediately call the child's parents so they can pick up the child and provide treatment for the child at home. Until the parents arrive, isolate the sick child to avoid spreading the illness to others. Have a designated area for the sick child to wait for the parent or guardian, with an assigned caregiver to monitor and tend to the child until the child's parent arrives. This area should be set up to make the child as comfortable as possible. The child may lay down on a nap mat to rest or take a nap, or the child can play quietly with a washable toy while he or she waits. It's ideal to have a washable nap mat in this area so it can be easily disinfected after the child leaves. Keep a lined trash can nearby in case the child needs to vomit or you need to throw away some dirty tissues. If the child has diarrhea or is vomiting, be sure to enforce hand washing and sanitation methods during and after their stay in the isolation area. When the child's parent arrives, explain the symptoms you have observed and what the child demonstrated or told you that they feel, such as a headache, nausea, or sore throat. Once the child who has had a communicable disease is well, you will need documentation from the child's doctor that it is safe for the child to return back to care on a regular schedule to ensure they will not infect other children with their illness. This production has been brought to you by the Texas AgriLife Extension Service. For more information, please visit our website at texashelp.tamu.edu or contact your local county extension agent.